they clarified everything that the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
Be prepared to have an open mind when you want to watch such a program.
If somebody else in your family starts showing signs that they might have it, it will make you more aware of it. Well, maybe they have diabetes.
Oh, I thought I knew, but I didn't. I had little knowledge, but that series expounded my knowledge.
For me, bad sugar have played a major important role in my life to control, to educate, and to teach others about diabetes.
Welcome. Today we begin a mini-series called Bad Sugar with a live audience. For those of you who do not know, Bad Sugar is a TV series about diabetes, which I produced. And with me today, I have some of the experts who were featured on that TV series. And I have an audience ready and available to ask questions. So stay tuned, and we will be right back. Today, I have 4 of the doctors featured on Bad Sugar. Thank you so much for joining us today. Dr. Rashidi, Dr. Radha Reddy, Dr. Brinegar, Dr. Carpenter. Let's begin with Dr. Rashidi. Tell us briefly what you do.
I'm a family physician in the area over in Upland, and I'm board certified in both family practice and in holistic medicine. And I have a practice at Women's View Medical Group where we do family practice, but with a concentration on women's health. And we have been specializing in nutritional and preventive lifestyle to help our patients to really, hopefully, prevent diabetes.
Absolutely.
And those who have it, to treat it as much as possible through lifestyle, diet, exercise.
Right, and on the Bad Sugar series, you talked about herb supplements, and we will get to that. Dr. Radha Reddy, you are an endocrinologist. Tell people what that is.
Endocrinology is basically the study of hormones. A bulk of what we do is diabetes. I'm board certified in endocrinology in private practice here in Rancho Cucamonga. My focus is on diabetes and mainly through awareness and education, because I think that gets to the patient better rather than just giving prescriptions.
And Dr. Brinegar from Loma Linda University, you are a diabetologist.
Diabetologist.
That is a mouthful. Tell people what that is.
Well, not any worse than endocrinology. But a diabetologist is one who is focused just on diabetes after internal medicine residency. And I've been doing this for the last 37 years at Loma Linda and have been enjoying it immensely. And I think even though I certainly would espouse the ideas that both of these two doctors have as far as lifestyle is concerned,
right,
I tend to become a pill pusher, so that will come into effect here this afternoon.
A pill pusher, okay, well, okay, we will talk more about that. Okay, Dr. Carpenter, dentist, and you also have diabetes, type 1 or type 2?
Type 1.
Type 1. And tell us a little bit about what you do.
I'm a general dentist, and I practice locally here. I also have my degree in public health and put a lot of emphasis on prevention.
Right.
This is my doctor right here, and who has served me well. And I come at this whole thing with a unique perspective in that I have to live with it.
Absolutely.
And so I have empathy for the patients who are diabetic and maybe can come with bring that to the table when we have discussion.
When we return,
there is still confusion. Let's clarify that, Dr. Reddy.
I think it's important to realize that there's 2 main types of diabetes. When we talk about diabetes, it's type 1 and type 2.
Then later.
Well, there are several herbs that have been shown to have benefit for diabetics. Probably number 1 among them, with a lot of new research coming out, is cinnamon.
what do you think about eating habits and diabetes?
I'm not a diabetic, but eating habits, they should pay attention to that because it's very harmful for them. It's a lot of, they can get in comas or get sick, blind, and different things like that. So they should be very cautious about what they eat.
I think it's a big problem in this country, and it definitely can be, prevented with better parenting, probably.
Obviously, I think that plays a big role. I mean, what you eat definitely plays a big role in diabetes. I mean, what is diabetes anyways? It's so-called high blood sugar, I should say. And so if it is high blood sugar and you have too much sugar in your body by eating a lot of sugar, obviously you have trouble there. So what you eat definitely has to correlate with diabetes.
Do you think a poor diet can lead to diabetes?
I think so. A lot of sugar and adjective, I think so.
I do. My cousin was diagnosed with that, and like I said, I mean, I think it has a lot to do with it. I think sugars and all that, it's not good for you.
Okay, well let's begin to look at the types of diabetes. Even though Bad Sugar series actually has 11 episodes which aired, and episodes 12 and 13 did not air and will not air. That's volume 5. It's a bonus track. People are still confused. The series was very detailed. It tells you the types of diabetes. There is still confusion. Let's clarify that, Dr. Reddy.
I think it's important to realize that there's two main types of diabetes. When we talk about diabetes, it's type 1 and type 2. Type 1 diabetes is a type which used to be called juvenile onset diabetes, and now it's called type 1 because we see it in children and adults. Here, insulin is needed for survival.
Right.
The pancreas does not make any insulin. Without insulin, the patient will die. So they need it from the time of diagnosis for the rest of their life. As opposed to that, type 2 diabetes is the more common type, what we used to call adult onset diabetes. And this is the one that is associated with a high genetics or familial predisposition with obesity in certain ethnic races. We also have gestational diabetes, which is diabetes in pregnancy.
Yeah, let me come to that later. Now, Dr. Brinegar, in the Bad Sugar series, you emphasized that having diabetes does not mean you will automatically develop complications. That is a big misconception, that because I have diabetes, I am doomed to have complications. That is not true, even in my practice. So address that.
Yeah, that certainly is a misconception. It's one of the myths of diabetes that when you have it, the inevitability of having blindness, kidney failure, loss of a limb is something that unfortunately has come about as a result of those individuals that do end up with those kind of complications have not been perhaps treated as aggressively as they needed to be early in diabetes. They haven't really been through an educational process. They've just sort of picked up bits and pieces of what they should do here and there. So I think it's reassuring to anyone with diabetes to know that if they do the things that they need to do,
absolutely,
and those will be outlined here, I'm sure, this afternoon,
yes,
that there does not need to inevitably be any complication from diabetes.
And some of the complications can be reversed. We will talk about that later on. Now, Dr. Carpenter, let's talk about dental care and diabetes. Huge, because you can lose your teeth. Talk about that.
When I was growing up, my grandparents, all four of them, had their teeth out of their mouth at night. And I thought that's what life brought. And I can remember having nightmares about losing my teeth. And I thought that was the way it was going to be. And they all lost their teeth most likely to periodontal disease. They used to call it pyorrhea. And be assured, everyone, that this is no longer the case. In my grandparents' time, 50% of Americans over the age of 24 had full upper and lower dentures. Now it's in the single digits. But diabetics, through high blood sugar, hyperglycemia, are more susceptible to periodontal disease, and thus we have to be more aggressive in the prevention of that.
Right, and that can lead to heart disease. We will talk about the link later on. And coming to Dr. Rashidi, a very popular subject, herbs, supplements, and diabetes care. Any latest information in that area?
Well, there are several herbs that have been shown to have benefit for diabetics. Probably number one among them, with a lot of new research coming out, is cinnamon.
Right.
There's also been other herbs that help. Fenugreek is one, Gymnema sylvester. These are herbs that have also been shown to either slow down the uptake of glucose from the gastrointestinal tract and also to utilize blood sugar more efficiently. There's also several nutritional supplements or vitamins. So there's many new areas of research going in this area.
Right. Well, let's take a break. When we come back, there are two other types of diabetes we will address: gestational diabetes, pre-diabetes. We will talk more about supplements and the different kinds of complications, more about dental care. Stay tuned. We will be right back.
When we return,
a couple of other phrases that are used are, a touch
Of sugar?
or a little diabetes, all kind of qualifying, and most people that use those terms are not fully convinced that they really have it.
I know.
then later,
But let's talk about the link between poorly managed dental care and heart disease.
Recently, they've linked periodontal disease to cardiovascular problems. This is being accepted now as fact.
coming up on the next episode.
My mom has diabetes and her bones are so fragile. She just recently cracked her rib and broke her toe. So is that due to her having diabetes or her bones being so fragile to break?
It could be a combination of many things. Dr. Breniger.
It's a combination of many things.
Yes, it is.
How come I'm getting all the hard ones?
When you say hypertension, what readings are we referring to here? We have stages.
Just high blood pressure, you're on medication. Can you ever get off the medication?
And the answer is yes.
What do you say about these young children having diabetes because of what they eat?
It's horrible. Isn't that horrible? I cannot believe young children having diabetes. And that's because the parents don't even know what they're serving them. You know, they don't take time to learn. And I have to admit, I didn't know either. You know, generationally, we haven't learned. Certain nations have learned how to eat right. But the rest of us in the Anglo relation, we don't know. We're not being taught.
Watch their sugar and their salt intake and eat a lot of vegetables and fruit and the meat. Watch red meat because it's not good for your digestive system.
My cousin Michelle, probably 3 or 4 years ago, was diagnosed with diabetes. And today she is probably going to be coming off the medication pretty soon. And it was all through diet and trying to change the way she eats and how much sugar she eats. And I think the biggest thing that people don't realize, because I wasn't really clear on it myself, was the balance. Is that when she would have a certain carbohydrate or whatever it was, she had to balance it out with a whole grain or a vegetable. And that was really amazing, because now I look at her and you look at old pictures and you can just see the illness, the ailment, you know, in the face and in the weight. And now she still has a few problems, but, you know, she probably will be off the medication. And that's the biggest testimony you can give.
That is so great, because people don't know that you can reverse type 2 diabetes through lifestyle. So it is great to know this. So what have you learned from her?
Actually, I've learned how poorly I can eat sometimes, but I think because we spend so much time together, she'll pack me a lunch, and it's always a vegetable or fruit every day. And I think I've learned that just integrating that one thing every day out of force in the beginning, it really has helped a lot. I feel better, and you know, it's easier when you don't do it alone.
Welcome back. If you are just joining us, today we are talking about Bad Sugar with a live audience. It's all about diabetes. It's a recap about the television series Bad Sugar. And with me, Dr. Rashidi, Dr. Reddy, Dr. Carpenter, Dr. Breniger. Now, going back to you, Dr. Reddy, you were talking about the different types of diabetes. Let's finish that up for people who are still unaware that we have 4 types.
we talked about type 1 and type 2. We have gestational diabetes,
Right.
that is diabetes in pregnancy. So it is basically the hormones of pregnancy oppose insulin. Your insulin requirement goes up about 3 times. So as soon as the pregnancy or delivery is over, generally the blood sugars return to normal. There's a small percentage of people, if the diabetes was really poorly controlled in pregnancy, the women can continue to have diabetes even after pregnancy. The fourth type is what we call pre-diabetes. And pre-diabetes is actually a new term that clubs in together what we used to call impaired fasting glucose and impaired glucose tolerance. These people are just as the same risk for cardiovascular disease as diabetes. So in clinical practice, we treat pre-diabetes like a diabetic with all the necessary precautions.
Right.
And just want to mention there's others, which is like secondary diabetes due to drugs or pancreatitis, etc.
And we'll get to those later. And I think the 4 main ones, the big ones. And if you are out there thinking there's something like borderline diabetes, there's nothing like that.
Exactly.
Because some of my patients still say, you know what, Dr. Ruth, I'm borderline. I'm like, oh, there's no borderline. You have it or you don't have it. Dr. Brenniger, you said that so well in the series. Let's talk about that. There's no borderline. And let's talk about some of the complications that can be reversed.
You're counting on my memory to say it the same way I did the first time.
No, new memory.
Yeah. Well, a couple of other phrases that are used are, a touch
of sugar
or a little diabetes, all kind of qualifying, and most people that use those terms are not fully convinced that they really have it.
I know.
And so they don't go about the business of doing something about it early in its course.
Yes.
And getting back to the complications, it's imperative that one identify diabetes at its very earliest stages.
Yes.
5 to 12 years before the diagnosis of type 2 diabetes is usually when the diabetes began. Even though it may not make a lot of difference as far as the treatment, it does make a difference as far as that person's impetus or the desire to really take good care of themselves.
Absolutely.
Because they know now that they have diabetes or they have a chance of avoiding it.
Right.
By treating it early and aggressively.
Right. And throughout the show, we will talk about some of the neuropathies and some of the other complications that can be reversed. I know some of you in the audience have questions, but let's talk about the link between poorly managed dental care and heart disease.
Recently, they've linked periodontal disease to cardiovascular problems. This is being accepted now as fact. And because diabetics, when their blood sugars are not controlled, are more prone to periodontal disease, and they also have more cardiovascular damage, this is a real concern. So at this point, if you're diabetic and you have periodontal disease, you really need to take care of yourself, or there could be problems that would be very catastrophic.
Right, and these are simple things they can do, like flossing.
Yes.
Talk about that, because it seems simple, but people still don't do these things.
In my experience as a general dentist is the people that come into my practice, my diabetics, they're seeing the dentist regularly and they don't have these problems. So I'm not familiar with those who are out of control. But being diabetic, I depend a lot on my dental hygienist, getting my teeth cleaned, and I get them cleaned every 90 days. I go a little overboard, but this is important, and being a normal human being, I enjoy eating.
Right.
And the enjoyment of eating it becomes more important the older you get. And I want to keep my teeth, and my patients who keep their teeth have a better life.
Absolutely.
And, all together. So brush, floss, eat properly, exercise, all these things, and see the dentist regularly. And there are lots of things you can do to manage dry mouth problems. Most of us are taking blood pressure medications, and that can lead to dry mouth. So you need to be aware of all these things, especially if you have dry mouth, and that can come with the aging process as well. But it's all enhanced when you're diabetic and out of control.
Right, and we will get back to you later. Dr. Rashidi, people email me all the time, and my patients ask me this. and I give them the standard answer. You are the expert on herbs. What is the research saying about the safety using herbs and conventional medications for diabetes management?
When we return,
Well, first of all, diabetes is the equivalent of having had a heart attack.
Yes.
You have a serious issue with cardiovascular disease. It's the #1 cause of death in diabetics.
Right, and the antioxidants.
Antioxidants, alpha-lipoic acid,
Right.
again beneficial from the standpoint of the heart disease as well. And many herbs that you would also think of as food, like garlic, just including more garlic and onions in your diet, more fresh herbs like
Right.
your basil and oregano.
Ginger.
Have an herb garden.
I am Ruth Tanyi, producer of the award-winning TV series called Bad Sugar. Do you have diabetes? Know someone who has diabetes? Unfortunately, all of us do. So listen carefully to what others are saying about the Bad Sugar DVDs.
I have type 2 diabetes, and I've had that for probably 30 years.
I've had diabetes since 1995.
I have watched all of the Bad Sugar series.
I have had diabetes since 1998.
I've watched the TV series Bad Sugar.
I'm a type 1 diabetic, and it's taught me how I can expand my lifestyle. It's taught me spiritually how to monitor my stress.
They clarified everything that the doctor was saying, but at a more slower pace, and to me, a very understanding pace to understand diabetes.
Oh, I thought I knew, but I didn't. I had little knowledge, but that series expounded my knowledge.
For me, Bad Sugar have played a major important role in my life to control, to educate, and to teach others about diabetes.
It showed how God operates through us and how we need to connect with God in order to make sure that those sugars operate the way that they're supposed to.
Bad Sugar.
Do you have questions about nutrition and diabetes? What to eat, what to avoid, counting carbohydrates? What about the glycemic index? Or questions about proteins, fibers, fruits, vegetables, fats? Or do you have questions about exercise, stress, spirituality, and diabetes? Or do you want to prevent diabetes complications? The Bad Sugar DVDs will give you the answers you are looking for.
There was things out there that I didn't know, and since I watched Bad Sugar, it's given me a lot of information that will help me further out.
Type 2 diabetes affects a lot of different things in your body, which I never knew about until I saw the episodes 7, 8, and 9.
It's taught me about nutrition, it's taught me spirituality, and it's taught me how to live my life and enjoy myself longer.
I was able to reduce my medicine, and that's due to the fact of the Bad Sugar.
Call 1-866-257-3471. Operators are standing by. Or log on to PreventiveCareWeekly.com and place your order.
Okay, now you know all about the Bad Sugar Diabetes DVDs. Get them for yourself and they will change your life.
To order a DVD, go to our website, PreventiveCareWeekly.com.
People email me all the time, and my patients ask me this, and I give them the standard answer. You are the expert on herbs. What is the research saying about the safety using herbs and conventional medications for diabetes management?
Well, first of all, I would put in the caveat that herbs are a type of medicine.
Yes.
And they should be managed in conjunction with an expert, which would usually be your physician,
Right.
who would know about both the medicines and the herbs and which ones can be combined and which ones are combinations that should be avoided and what to monitor and what to watch for.
Right.
And in general, herbs are very safe, but there are some herbs that do have interactions with medications, and it's important to let your physician always know and not just go on your own and you read this or that in a magazine and you add it to your regimen but don't happen to mention it to your physician. That's not a good idea.
And that's what we're seeing a lot. You know, the patients go out to the drugstore and they read up something and they grab it and they start taking it right away without any consultation, and that can be deadly. So please don't do that. And let's talk about other nutritional supplements that are out there for diabetes right now.
Well, first of all, diabetes is the equivalent of having had a heart attack.
Yes.
You have a serious issue with cardiovascular disease. It's the #1 cause of death in diabetics. And it is something that you should be looking at in conjunction with your diabetes treatment. So things like controlling your cholesterol, and herbs like red rice yeast extract can help with that. Niacin is very effective, again in conjunction with your physician, because niacin can have an effect of lowering the triglycerides, which is good, and raising the HDL, which is good,
Right.
but it also has some effects on blood sugar.
Absolutely.
And on the liver, and so do some of your many diabetes drugs. But they can be instrumental, and they're a natural therapy that can be used, and used very effectively. The other things that you want to be looking at are, again, you can't really leave out the importance of exercise.
Oh, I was going to mention that
And I'm
exercise
sure we're
and
going to talk
balanced
about it.
diet. We will talk about that.
Yes. And then another one is fish oil.
Right.
Fish oil has been documented to lower the risk of heart disease. It's also been documented to lower the risk of sudden death. At the time of having a heart attack, you quite frequently go into a rhythm problem
Right.
that can be immediately fatal.
Right.
And fish oil has been shown to be quite effective at blocking that rhythm disturbance.
Right, and the antioxidants.
Antioxidants, alpha-lipoic acid,
Right.
again beneficial from the standpoint of the heart disease as well. And many herbs that you would also think of as food, like garlic, just including more garlic and onions in your diet, more fresh herbs like
Right.
your basil and oregano. and
Ginger.
have an herb garden and use it.
Homegrown garden.
And those things are very beneficial. They are not generally all by themselves adequate to completely control the condition. You should still be going into a doctor and having it monitored.
Absolutely.
But it's certainly a good thing to be including in your diet.
Yeah, well, that's all we have for this show. When we come back, we will take questions from the audience, so stay tuned. For more information, please visit PreventiveCareWeekly.com. See you on the next episode. Goodbye for now.
This program is not intended to be diagnostic or prescriptive. Please consult with your doctor or healthcare provider before adopting any of the lifestyle changes or other measures discussed in this program. We do not recommend any medication changes. Rather, patients should seek medical advice from their doctors or healthcare providers.